Kamengere, known to many as Toto Touch, took her final breath under circumstances that have since sparked outrage, confusion, and sorrow. Her death at Bryside Chiromo Hospital Group has left behind a trail of disturbing questions. A chilling audio recording made shortly before her demise reveals that she was forcefully taken from her home, injected with unknown substances, and admitted to the facility without her consent. As her family mourns, they are also seeking answers. Vera Mora has been following this story and now reports.
Dr. Susan Njoki Kamengere was a passionate mental health advocate, founder of Toto Touch Kenya, and a voice for children and families struggling with emotional and psychological challenges. Known for her compassion, leadership, and personal openness about living with bipolar disorder, she dedicated her life to breaking stigma and improving care in Kenya. Her sudden, violent death shocked the nation and ignited calls for justice. Susan Kamengere Njoki built a career at the intersection of clinical nursing, child welfare, and grassroots mental health advocacy, a path that carried her from hospital wards into the public eye. Trained as a nurse, Njoki worked in clinical settings, including Nairobi Hospital, and later gained experience in health management roles. Those early years shaped a hands-on, patient-centered philosophy that would define her later work. Her professional grounding in nursing gave her the clinical credibility she used to critique gaps in Kenya mental health services and to design community-facing programs. In the years before her death, Njoki became best known as the founder and chief executive of Toto Touch Kenya, an organization she established to fill glaring gaps in psychosocial support for children and caregivers. Toto Touch positioned itself as a hybrid, part community outreach program, part therapeutic space, offering counseling, parental support, and awareness campaigns that address trauma, depression, and social stigma that often surround mental illness in Kenya's community. The organization work ranged from school-based sensitization to tailored support for families navigating child welfare and behavioral challenges, which made it visible and trusted presence among Nairobi-based NGOs and faith-based groups. What set Njoki apart from many other health professionals was her willingness to speak publicly about her own lived experience with mental health struggles. She openly shared that she had a history of mood disorder, bipolar disorder, a disclosure that transformed her from a private clinician into a relatable public advocate. By combining clinical training with personal testimony, she helped reframe mental health conversation in Kenya from abstract policy debates into human day-to-day realities. Her testimony and outreach work made her a bridge between medical providers and communities that previously distracted psychiatric services. This authenticity amplified her voice in advocacy circle and made Toto Touch synonymous with compassionate, survivor-led mental health care. On the night of 14th July 2025, Dr. Susan Njoki Kamengere began to signal that something was wrong. Her condition reportedly took a turn. According to accounts from her husband, Alois Ngore, she began showing signs of emotional distress and erratic behavior. Relatives would later question these claims, suggesting instead that she may have experienced a personal conflict or dispute rather than a full mental breakdown. The circumstances of her condition during this time remain contested, with no medical records publicly confirming that the onset of acute psychiatric symptoms. Social media posts attributed to her hinted at distress and an impending forced removal from her home. In one now removed message, she claimed that several individuals, 2 men and 2 women, had restrained her, injected her with unknown substances, and were preparing to take her away. Friends and supporters later said these posts were deleted shortly after appearing online, and her phone went silent. This was the first public sign that something serious was unfolding behind the scenes. The following morning, 15th July 2025, a small group arrived at the residence in Kileleshwa. According to family accounts reported in the media, this group included individuals allegedly linked to her personal circle, as well as medical practitioners. Witnesses stated that Njoki resisted but was injected with a sedative on site before being transported to Chiromo Hospital Group's Brisside branch, a private psychiatric facility. Reports indicate this admission was not voluntary, raising immediate concerns about possible breaches of Kenya's Mental Health Act, which requires strict procedures for involuntary psychiatric care. But her husband, Gore, is said to have made the decision to seek mental assistance. Witness statements indicate that she was taken, reportedly without her full consent, to Chiromo. The precise circumstances of her admission have been a focal point of public scrutiny. Some accounts suggest that she resisted, raising concerns about whether she was sedated or coerced. At Chiromo, Njoki was admitted for psychiatric observation and treatment. This was the last time many of her friends and family saw her conscious and able to speak for herself.
This is wrong and no patient should be taken through this. And I'm of right mind as much as.
Upon arrival at Brisside, Njoki was reportedly given further medications. Officials' record of what was administered have not yet been publicly released, but family members claim she was injected again shortly after entry. At this point, she was fully under institutional control. This marked a critical turning point, the moment when her life moved entirely behind closed doors, and the chain of events became dependent on hospital oversight. Some reports suggest Njoki had her last meal shortly after admission and was alive for only a few hours afterwards. Exact time remains under investigation, but the sequence of events within those walls is at the heart of the criminal inquiry. Hospital staff have not publicly detailed when she was last seen conscious, who attended to her in those final moments, or when she was first found unresponsive. What is clear is that by the end of the day, Njoki was dead. She was officially pronounced dead in the same day she was admitted. Initial statements from some quarters suggested a natural or psychiatric-related cause. However, suspicions quickly grew when her family, civil society groups, and media began pushing for a post-mortem examination by independent pathologists.
In my life today, I'll be given a chance. Ningekuwa na simu niongee na royal media. Saa hii, I'm sure wacha ngoja. Nipige huko, nikae show, wachini discharge.
The speed of her deterioration within hours of arrival fueled calls for transparency. On 17th to 18th July 2025, a panel of pathologists conducted the autopsy. Their findings were unequivocal. Njoki had died from manual strangulation. This ruled out natural causes and reframed the case from a medical incident to an active homicide investigation. Additional forensic work, including toxicology, was ordered to determine whether sedatives or other substances were in her system at the time of death. The post-mortem results became public on 24th July 2025, sparking outrage across Kenya's civil society and medical sectors. The Federation of Women Lawyers, FIDA Kenya, condemned the killing, pointing to violations of her rights to dignity, consent, and due process in mental health care. The Ministry of Gender issued a formal statement demanding urgent and transparent investigation. The Directorate of Criminal Investigation, working with Kabete Police Station, arrested several individuals of interest, including Njoki's husband and psychiatric identified in media as Dr. Onyancha and certain hospital staff. These individuals were later released on police bail pending further inquiries. By 25th to 26th July 2025, the institutional response escalated. In a rare move, the Kenya Medical Practitioner and Dentist Council, KMPDC, ordered the immediate closure of Chiromo Hospital Braeside branch and the evacuation of all patients within 24 hours. The council demanded the hospital hand over Njoki's full medical records, admission document, and any CCTV footage. Regulators cited potential breaches of medical ethics, clinical procedure, and statutory patient protection. Investigations are still underway.